Welcome back, everyone, to another episode of It's a Rare Thing. Now, if you've followed the series so far, you'll know this is a series that is about a very rare condition, Syringomyelia, and its associated partners. That would be Chiari, malformation, etc., etc. And today, I'm absolutely delighted to be joined by Sara. Sara, if I pronounced your name correctly.
You have.
It's a good start. It's a good start. Sara is from the Walton Centre, which is it's just an amazing place. So Sara, can you tell us a little bit about yourself and the Walton Centre?
Okay, so I've been here as a nurse for almost 31 years. Lots and lots of different roles, all within neurosurgery. And around and about 2007, I was approached by a consultant to set up a nurse specialist service for patients with Chiari, Hydrocephalus, all things CSF related. And I currently run a service which covers all CSF diversion procedures. And we have a team of 3 of us who work specifically for this group of patients. And my specific area of interest is Chiari malformation, Syringomyelia, hypermobility, and the CSF dynamics that make these conditions what they are.
Wow. I've got so many questions for you. That's just quite incredible. First of all, why was this unit set up? What was the problem it was trying to solve? Did your neuroconsultant surgeon see a deficit within the NHS in terms of establishments that supported CSF conditions?
Yeah, I think, the consultant that I work with at the time is quite an eminent CSF almost a guru, I would probably say.
Okay.
And he approached me because of the experience that I had in running the neurosurgical ward at the time. And we used to get a lot of patients that came in with hydrocephalus and Chiari malformation, Syringomyelia, and they weren't all treated the same. So we had a discussion one day and I said, we should be treating all of these patients regardless of which consultant they're under, what day of the week they come in, where they come from. We should be treating them all in a standard way. And I presented a business case to the divisional manager at the time, and they allowed me 1 day a week because we saw a gap in our provision. And it just went from there, really.
We've spoken on the series Chiari malformation or Chiari malformation. Mm-hmm. You say potato, I say potato. We talked about Syringomyelia. Hydrocephalus. Can you just talk to me a little bit about what that condition is for maybe listeners who might not be familiar with the term?
Yeah, so there's lots of different types of hydrocephalus. So we see it in babies that are born prematurely, post brain hemorrhage, post tumour surgery, pre-tumour surgery. Babies are just born with it and we don't know why. And it's basically a mismatch between the ability to produce CSF, the fluid that surrounds your brain and spinal cord, and the body's ability to absorb it or move it round like it should move. And we provide treatments that divert that fluid away. So to avoid the blockages or to avoid the non-absorption of the fluid, we put in shunts or we do procedures like an endoscopic third ventriculostomy, which means there's nothing left in the brain to divert the fluid except your own body's the hole that we make in the fluid container. So there's lots of different ways of moving this fluid around, and I specialize in those forms of treatment.
Absolutely remarkable. And hydrocephalus, is that more prevalent in infants and young people, or does it follow through in terms of later on in life as well, and depending on surgery?
Yeah, it can be any age. Obviously, premature delivery is a huge cause for it. We don't see as much in the way of congenital abnormalities these days due to the medical screening. prenatally, as we did maybe 30, 40, 50 years ago. But we still do see it from time to time. We obviously are an adult unit here, so we do see patients that are diagnosed plus from 16 upwards through various reasons. So it's all ages really, and we endeavour to treat them all.
And is it always as a result of surgical intervention that hydrocephalus can occur, or is it can it? I hate to use this term, but I will do. Can it just occur naturally? Like
Yeah,
perhaps maybe grow over time. You can be unaware of it, and then
yeah,
suddenly you're aware of it because of symptoms. So you've been
absolutely.
asymptomatic for a number of years, and then suddenly problems start.
Yeah, absolutely. So it can come out of nowhere.
Wow.
Patients age 50, 60 can all of a sudden, for some reason, develop symptoms that, they've never had before. And when we send them to the CT scanner or the MRI scanner, they've got hydrocephalus and it needs to be treated. So yeah, we can cause it post-surgery, but we also see them just, out of the blue presenting, having never had any problems before.
And again, it's a bit of a newbie question for me, so apologies for asking it. Is it a condition that can be cured or only managed or both?
Um, I would say managed,
Sure.
but management can include them not having any further symptoms, not requiring any further surgical intervention, and being well and having a normal life, going on holidays, working, climbing mountains, jumping out of aeroplanes, those types of things. So although it's a management answer,
Yeah.
actually it can have some very, very good outcomes.
Absolutely fascinating the work you do and with the Walton Centre. So you were asked to join the Walton Centre and sort of help set this up.
Mhm.
What's the for you? What was the I don't know. What was the draw to specialise within this field?
I was, well, from the very start of my career, way back,
Hmm.
I've worked within
Let's go
neurosurgery.
way back, Sara. Way
Yeah.
back.
So when I was training, I always enjoyed neurosurgery. And we had a really good ward manager at the time when I was a student. And she really inspired me to carry on and try and get a job here. And jobs were very few and far between here then, because you only got a job when somebody left,
Sure.
or moved on, or even died. So when the job came up, I jumped at it and sort of worked my way across the wards, across the areas within neurosciences. And I really enjoyed neurosurgery. Got a sister's post. And then obviously when I was working on that particular ward, a lot of the patients that we saw were involved with this consultant. And I just thought, this really interests me, the actual CSF dynamics and the anatomy and physiology behind the conditions is really what interests me. And the ability, I suppose, to have somebody who's very, very poorly or very becoming, very affected by their symptoms, and being
Mhm.
able to help their management,
Mhm.
really, made me feel that we were making a difference.
Mhm. The Syringomyelia, I mean, I can only speak from experience, but having spoke to now quite a few others, it's a very, I find it still to this day actually a very confusing and, if I'm honest, slightly frustrating condition. And I mean, not 2 days, no 2 days are the same.
Yeah.
And I do have difficulties. I'm going to be completely honest, certainly around mobility and balance.
Mm.
But again, it's just understanding. I suppose the question you might be asked quite often is the origins of syringomyelia. Why have I got this? Where has it come from? And
Yeah.
and is the truth to this day really still we don't know?
Yeah, unfortunately so. We don't know whether, I mean, obviously we see, post-traumatic, so post-spinal injuries, patients can get syringomyelia. We see it post and alongside the Chiari conditions, as you said quite eloquently in your introduction. But we also see it in patients that have had none of those and just develop it. We don't understand why. And all we can do is try and manage it and treat it as best we can with what we see in front of us and the symptoms that they present with.
Yeah, no, absolutely. Because I don't have Chiari malformation. My Syringomyelia. I'm not going to say just appeared. Looking back at the history, I can now start to track back certain, certain pointers where actually, I was thinking, could it be this? Could it be that? Oh, don't worry, it's probably just probably having a bad day. Oh, that's right. The GP says it's sciatica.
Yeah.
And then of course the symptoms become progressively worse, and there's then irreparable damage that's probably taking place.
Mm.
When you would typically, when a patient comes to you, is there a particular stage that they're at?
No, it can vary quite considerably. I see a lot of patients in a very specific clinic before they undergo any surgery for either of these conditions, and each person is affected so very differently. And even scans and things, you look at a scan and you think, wow, they're going to have a lot of symptoms, and they may not have very much in the way of symptoms, and we don't need to do anything surgically. And other patients can have a very small syrinx, but have a myriad of symptoms that really affect them on a day-to-day basis. So the point at which we would normally consider surgery is when they start to worsen, and it's really starting to affect them, not to a point where they're unable to now do things, but when it's something is progressive, when we can see an active progression in their symptoms, regardless of what the imaging shows, then we would be considering whether or not we need to provide any surgical intervention, or if there's any surgical intervention we can offer.
Fine. Now, at this point, I suppose I should say, for those of you listening who haven't listened to the other podcast, where on earth have you been? But perhaps maybe we should give a brief explanation as to what a syrinx or a cyst is, so people can understand that terminology. So, how would you describe in layman's terms what a syrinx is, what syringomyelia actually is?
So for us, it is a collection of fluid within the spinal cord that is causing difficulties with the nerve conduction and nerve pathways of the signals getting through. So you can end up with numbness, tingling, burning pain, limb weakness, all kinds of symptoms from it. And sometimes it can be caused by, the fluid not being able to move like it should. And sometimes it's just there. And we shouldn't really see any large amount of fluid within the spinal cord at all. You can get a normal variant of a very small, thin amount of fluid within the central cord as a normal variant. But the cases that we tend to have referred to us have far more than that. And that's what causes the problems.
Interesting. I think I've been told, and I'm not boasting, but mine's pretty long.
They can be. They can
It's
be
pretty long.
very small, and they can be what we call holochord, which is from top to bottom.
Yeah. And I had a decompression surgery, but obviously they weren't able to drain the cyst, unfortunately, because that would have led to probably some paralysis, to be honest with you. So it kind of sits there, but just works its magic occasionally.
Every now and again, just let you know of its presence.
Oh, for sure, absolutely. And again, just in terms of those, that was really fantastically described. Thank you. In terms of Chiari malformation, again, for people just listening, just tuning in, how would you describe that?
So when I see my patients in clinic, I say a Chiari malformation is like a plug in a plug hole.
Oh,
so the cerebellum and the posterior part of the brain is basically too far down towards the spinal column and spinal cord and get stuck. So where the skull ends and the spine starts, you get like a little funnel almost, and the brain can be stuck down into there. And each time a patient coughs or sneezes or bends forwards, it causes a little bit like a hydraulic effect, pushes the pressure up, that pushes the brain down, causes the momentary or minatory symptoms, and then it releases, but not fully. So the fluid can move around the brain and spinal cord, but not effectively enough not to cause those cough and strain, the Valsalva symptoms that we see in Chiari patients.
Right.
So
Okay.
for the surgery, I say we take the plug out of the plug hole
Yep.
and allow the fluid to drain as it should.
It's a fantastically visual description. I've got it.
I do try.
You do. Yes, it's fantastic. It's great. So the what's the questions that you are asked most from your patients? Because I guess there's going to be quite a few listeners listening to this who will be asking those same questions if they're going through a new diagnosis, or if they're going to be referred to you or one of the other neuro centres around the country. What are the most, I guess, typical questions that someone will ask you when they are newly diagnosed?
If they're offered surgery, will the surgery, solve all of their symptoms? And I have to be really honest and often say no. It might not get rid of all of your symptoms. It may help the more severe of your symptoms, i.e. your cough or strain headache. If you've got sensory symptoms, they're the last thing to be helped with the surgery. So motor, movement and things are always helped first. Also, if I don't have any surgery, am I going to be, become more
disabled,
develop more issues, more disabled, more affected by my symptoms than I am at the moment? And again, we don't know. We have to answer that really honestly and say, we know over the last 6 months or 12 months or 18 months, you've been stable. You've had a little bit of progression, or we've seen a slow and steady deterioration in your symptoms. So we would anticipate that those sort of pathways would continue, and sort of make the decision making for them as easy as we can with the information that we have to hand.
Yeah, because that's the key, really, isn't it? As somebody in your position, it's about information and guidance. It's not necessarily about advice, which I guess is something that's almost impossible to give.
Yes, I'm not that person. I'm not that patient. I can, regale risks of surgery. I can give them all of the information for them to make a really informed decision. We can have multiple conversations before they make that decision, so that they're clear in their own mind why they're entering into that contract, why they are going to take that chance and say, okay, my symptoms are bad enough at the moment or are getting worse. I will take the risk of it not helping or there being a complication over how I am now. Equally, for the patients that decide not to have surgery, we leave the door very much open. So if they say, I know I'm getting worse, but I'm not ready to undertake any surgery or any treatment at the moment, we just offer them, where we are. If things change and you change your mind, then let us know and we put you back into the system to come and rediscuss with the surgeon.
The one thing I didn't know when I elected to have surgery, well, actually, I don't think I got to the point where actually my walking was so bad that if I didn't have surgery, I'd absolutely end up in a wheelchair pretty quickly. But what I didn't know at the time, and I just wonder if you can clarify this, is there a risk that actually surgery in the short term could have great benefits, but in terms of syringomyelia, with the scarring tissue over time, that actually that could cause a future problem?
Yes, absolutely. Any surgical intervention can cause scar tissue. Your body is an amazing thing and tries to heal. And often that is what causes more of an issue, in that, you get scar tissue that then starts to close in on the pathways that we've made for the fluid to move.
Yeah.
The scar tissue has no elastic in, so there's no give with that tissue. So yes, absolutely, it can cause problems later down the line.
It's such an impossible decision for patients to make, and because I think the spine is a bit like the brain. It's the whole neurological system is such a dark art in terms of even with the finest of minds. And I've met, like yourself, some of the finest neuroconsultants and surgeons, and sometimes you can just look into their eyes and see the bafflement in terms of there's still so much we don't know.
Yes, absolutely. It's not an exact science.
No.
It's an assessment of all the things, all the symptoms, the patient themselves, how it affects them, what the images look like, what the scans and things show, what their other testing shows. Have they got any other conditions that may affect it? It's just such a whole, a big jigsaw puzzle that has to all be put together.
Yeah.
But you may never find that final missing piece.
No,
which is quite frustrating at times, and I can imagine would be devastating if your condition was slowly deteriorating and things that you were being offered or surgical approaches that you were using or whatever were not helping.
No, but I suppose the upside, and of course there's a massive upside, is there's people like yourself, the Walton Centre, and fantastic neurosurgeons and consultants out there who
across the
absolutely
country,
have an incredible interest and talent for dealing with these types of conditions. So look, okay, I want to move on. A couple of questions from just before we sort of wrap up is post-surgery, post-intervention, post-treatment, living a life as best you can normally with these conditions. Are there any things you should avoid? And I've got a question for you. Here's a complete idiot question. I haven't got an irrational fear of flying. I don't have an irrational fear of flying, but I'm conscious of the fact that this is completely nuts. Okay, like when you go into an airplane, your ears pop, and the fluid in your ears expands, and you get this, and it can be really uncomfortable, really quite painful, unless you're chewing or drinking or whatever you do. I'm talking about drinking water here, not scotch, but although that could help. So somebody with a cyst like myself, is there a risk of when you get into an aeroplane that this cyst could also expand, like the fluid in your ears? Is that irrational? Are there things we can do to avoid or help ourselves?
I mean, I suppose there's always the risk of anything like that happening to anybody, and I think the idea of the pathophysiology of your ears popping or whatever, I can understand would make people worry, but I have people with all of these issues who travel all over the world. They mountain climb, so they change, altitudes. They often say they feel better at higher altitudes. I think the idea of living with something that could cause you to deteriorate in the future, but we don't really know. I think the message is do what you can when you can. Enjoy your life. Don't let things stop you.
Yeah. I love that because all too often, and the question, I asked this question quite deliberately because the seed of the idea was placed by none other than the very eminent Dr. Google. And that's probably the one place, the one person you should never consult with.
Yeah, they're not medically, as you know, they're not, and if we all do it, we all absolutely do it. But it's not medically monitored, and the information can be put on there by anybody pretending to be anybody. So I would, if you've got concerns like that, I would certainly speak to your neurosurgeon, speak to your nurse specialist, and book it and go and enjoy.
and you're quite right. Don't be defined. Don't be defined by your condition, right? We can all have very exciting, very worthwhile and fulfilled lives, careers, pursuits, hobbies. If you're of positive mind and you've got the will and determination, you'll work around anything. You'll find a way. Don't be defined by it. Don't be held back by it, and certainly never, ever, ever let it knock your confidence.
Absolutely. Although I'm sure at times that's really difficult.
Of course.
And I'm sure it's very challenging. But absolutely, none of us know
No.
what's ahead of us. So I think, take the bull by the horns and just enjoy what you can while you can, and deal with anything that crops up in the meantime.
Now, I want to just switch lanes for a second, if you don't mind. You're organising
Yep.
something quite spectacular. I can say it's spectacular because I've got a real vested interest that actually the finest minds come together to discuss the finest treatments. Syringomyelia
Mm-hmm.
2025. What's all that
Yeah.
about?
So one of our consultants here has again an interest in Chiari and Syringomyelia, and he's setting up a conference for medical professionals, allied health professionals, between the 2nd and 4th of July this year here at the Walton Centre. It's an international conference, and it's aimed at looking at where we are up to now with, treatments, examinations, surgical intervention, all of those things for patients with Chiari, malformation, Syringomyelia, and the neurosurgical conditions that are associated with that, such as Ehlers-Danlos loss. And we've got lots of really eminent speakers coming from all over the world to look at, defining what these conditions are, how they're treated, how the surgery is done, what the best way to do the surgery is. Do they have any specific, pearls of wisdom that they could pass on to other medical professionals? There will be lots of papers presented, so lots of more junior medical staff will be doing audits and writing papers for the conference, and the Anne Conroy Trust has very kindly offered to provide a prize for the best one, which helps or which aids development of an element of the treatment of Chiari malformation and Syringomyelia. But it looks absolutely amazing, the lineup at the moment. And we've got neuropsychology, we've got pain management, we've got physiotherapists, occupational therapists with an interest, again, ANPs, nurse practitioners, nurse specialists speaking, pain management consultants, all kinds of people, all hoping to gain some knowledge on how we look after our patient group and to maybe try some new practices, to look at which old ones are still working and should we carry on doing them, and the relevant new research that's available from across the world to aid our patients.
What an amazing event, because that's the key. Information is key, and pooling experiences, just joining the dots and actually what might work over there could work over here. And
Absolutely.
that's just so exciting. And it's a range of specialisms. That's the other thing, because I think all too often I see this in media, it's sometimes you can be a seasoned professional and not be entrenched, but actually have a way of thinking, a mode of working, an understanding of certain, an understanding. But actually that should and could always be challenged by those who are newly qualified or coming from a left field perspective. And
absolutely.
that's so important, so important.
And every day's a learning day. And
every day's a school day.
It is. And absolutely, the consultants who are consultants for 1 year or 10 years, they still want to know what's new, what we could be doing. They're all involved in research, and it is all about what's best for the patient. It's all about how can we improve on what we provide? How can we involve the patients more? How can we listen? And I mean, really listen to what they're saying as to what the main issues of their conditions, how it affects them. How could we maybe look at things differently? It's not all about the surgery, it's about the complete management of the patient. And I think this conference that we've arranged really encompasses that.
Absolutely.
Which is fabulous.
Sara Kewen from the Walton Centre, you are amazing. I wish you every success with Syringomyelia 2025. I hope to be there representing the Anne Conroy Trust, because I just think it's going to be just one of those amazing events, and who knows what gem of a discovery people will suddenly just discover. So yeah. Look, thank you so much for giving up your time today. I really appreciate it, and I'm going to give you a little round of applause from me, because I just think the work you're doing is so incredible.
Thank you.
And hopefully I'll see you very soon.
Yes, lovely. Take care.
Thanks, Sara. Thank you.
Bye-bye.
Take care. Well, wasn't she terrific? That was Sara there, absolutely amazing, from the Walton Centre. Got to apologise for the sound quality. My fault, really. I said to Sara before we started recording, get as close to the mic as you can. And then she got very close like this. And before you knew it, there was a few pops and etties, but we don't care, because the most important thing is what is said. So, yeah, just an amazing person at an amazing centre. So if you want to recap on what the Walton Centre is all about, well, it's a leader in the treatment and care of neurology and neurosurgery, very much placing the patient and their family at the heart of everything they do. They are the only specialist hospital trust in the UK dedicated to providing comprehensive neurology, neurosurgery, spinal and pain management services. And I've got to say that rated as outstanding by the Quality Care or the Care Quality Commission. So yeah, and champion change throughout the field of neuroscience. So absolutely amazing. They were formed in 1992 and they received the trust received Foundation Trust status in 2009. And they're in, I can't really pronounce this properly in terms of where they are. I think it's Visakali. Oh, Liverpudlians are going to just be absolutely beside themselves with laughter with that pronunciation. But they're in Liverpool, okay, so at least I can say that bit, okay, without fear of any yeah. So that's the Walton Centre. Do look them up. If you want the web address, it's www.thewaltoncentre.nhs.uk. The Walton Centre. Walton is spelled W-A-L-T-O-N. So www.thewaltoncentre.nhs.uk. But of course, in terms of Syringomyelia and Chiari malformation, the leading charity here in the UK is the Anne Conroy Trust. So, if you need any advice and guidance, I'm not going to say advice, I'm going to say information and guidance around those conditions, the treatments or support that is available for you perhaps in your area, do look up the Anne Conroy Trust, an amazing organisation. Right, okay, on that note, I will love you and leave you and perhaps see you again for more It's a Rare Thing presently. Take care.